Hello, my name is Allan and I'm a first year PhD student at the Sheffield Institute for Translational Neuroscience. Today I'd like to show you some exciting new work from our group. So hexanucleotide repeat expansions in C9orf72 are the most common genetic risk factor for ALS. You can see the potential pathological mechanisms on the right, including production of sense and antisense foci. The triggers for the switch between the pre-symptomatic and symptomatic disease state, which emerges with age, are currently poorly understood. Our group has developed induced neural progenitor cell models from fibroblasts, and their astrocyte derivatives retain the aging features of the donor fibroblasts, crucial when studying adult onset disease. These reprogrammed astrocytes contribute to motor neuron injury in vitro co-culture systems, and astrocytes specifically from C9orf72 patients produce RNA foci. So as the methodology, we take fibroblasts and retrovirally reprogram them over the course of 18 days to produce mature iNPCs, positive epaxics and nestin. And these can be differentiated into astrocytes positive for vimentin and CD44, and then were used in assays including the co-culture with murine HB9 positive motoneurons and fluorescence in situ hybridization assays to look at the production of C9orf72 RNA foci. So in this study, we took an ALS family where the proband had the C9 repeat expansion and a novel TARBP A321V mutation. A further sibling also developed ALS a few years later, and another one was asymptomatic at the time of biopsy collection. We first determined that all three siblings possess both the C9 repeat expansion by repeat prime PCR and the TARBP mutation. So then looking at the RNA foci, we found that both the symptomatic and asymptomatic astrocytes produced antisense and sense foci, but there was a bias towards sense foci production in these astrocytes. The asymptomatic astrocytes produced significantly less foci than the symptomatic siblings. In the co-culture system, symptomatic astrocyte lines induce significant motor neuron death in co-culture, whereas the asymptomatic astrocytes demonstrate a survival of co-culture motor neurons comparable to the level seen in healthy controls. So in conclusion, our in vitro astrocytes from an asymptomatic individual carrying 2 ALS genetic risk factor show markedly reduced pathology when compared to clinically affected siblings with the same pathogenic genetic changes. Now further work is needed to accurately measure the C9 repeat expansion and its expression, and look at additional pathological features including the TDP proteinopathy, C9 DPRs and haploinsufficiency, and see the effect of these mutations. And this ALS patient model with retained features of aging will help to provide new insights into the switch between pre-symptomatic and disease states in familial ALS. Thank you for taking the time to listen to my presentation, and I'm happy to take comments or questions in the poster sessions.